So we're rolling up on the scene. Scene is safe, applying PPE. As I roll up on the scene, the mechanism of injury is clearly a motorcycle accident. There's one patient. I'm going to request additional EMS assistance, and because it looks that the patient is unconscious and that this is a trauma situation, I'm going to apply C-spine on the patient. As I roll up, my chief complaint would definitely be unconsciousness. So I would immediately check for pulse and for breathing. He has chest rise and fall. I'm checking for a pulse. He does have a pulse, and I'm going to apply a jaw thrust just to help with his breathing, and apply a C-collar to allow for stabilization of the neck. So my partner will be applying that and then holding C-spine for the remainder of the examination to ensure care of his spinal cord. Next, I'm going to put in an OPA to allow for ample amount of oxygen, and I'm going to apply oxygen, and I'm going to apply O2, a non-rebreather mask, for because he's a trauma patient, just to help with his breathing. Next, I'm going to check for pulse, his vital signs. He does have a pulse, so the next thing I'm going to check is his breathing is there, his airway is open. I'm going to check for his circulation. His skin is pale, moist, and clearly early signs of shock. He has no signs of external major bleeding, however he does have a pulse. And now I'm going to check for vital signs to make sure that he has all of those going on. I'm going to feel for pulse. He has a pulse of 42, so a very low pulse. His respirations are 7 times a minute, and his blood pressure is going to be very low at about 96/50. So he is definitely a priority patient, so we want to transfer him as quickly as possible. I'm going to do a rapid head-to-toe secondary assessment. Because he's a primary patient, we're going to reassess his vitals every 5 minutes. So I'm going to start by palpating the forehead with my hands and his entire cranium for any crevice or skull fracture. I'm going to start in the front and work my way back and along the sides for the temporal regions and make sure that everything is intact. Then I'm going to feel the cheekbones and the mandible, as well as the zygomats, to make sure that he has no facial fractures, as well as the eyebrows for the lower part of the frontal bone. And then I'm going to feel for the back of the neck to make sure he has no cervical fractures on the back of his neck or compression occurring back there. As I make my way down the patient, I'm going to move to the chest region and check for bilateral equality on both sides of the chest when it comes to the ribs, to make sure there's no any kind of breakages or fractures in the ribs. And then I'm going to palpate the 4 abdomens in a clockwise manner to make sure that there's no rigidity or possible internal bleeding occurring in the abdomen. As I get more down towards the body, I'm going to check for his pelvic area. I'm going to squeeze in and push down to see if there's any looseness in his pelvic region. There isn't at the moment. And during this entire time, I am doing decap BTLS to look for any abrasions or any kind of open skin wounds on his body. Next, I'm going to move down to his left leg and feel every section of his leg. to make sure there are no breakages occurring or distortions. There are none. I'm going to remove his shoe, and then I'm going to check for his PMS on both limbs. But starting with the left, I'm going to feel for a pulse, and I'm going to check for motor and sensory. On the foot, he has neither motor or sensory, but does have a pulse in the lower left leg. And as I make my way to the right side, I'm going to feel all the way down the left leg. Oh, there is a decent amount of swelling occurring in the right side of the leg right here. A possible femur fracture, because there is also a deformity once I remove his pants. I can see that visibly. And as I move down the leg, I'm going to feel for PMS down here as well. He has no pulse in this right limb and no motor or sensory either. So that gives me more sign that there is a fracture and probably a large amount of internal bleeding occurring in the femoral area. Now I make my way back up to the top of the patient, check his clavicle area, feel down the left side of his arm, again checking for decap-BTLS, any kind of deformities or contusions of any kind on the left hand. I'm going to check for PMS on this left side, so he has pulse, no motor or sensory capability over here, and then I'm going to do the same thing. Start at the clavicle, work my way down the entire length of the arm, check for PMS here as well, has pulse, no motor or sensory either. Next, with the help of my partner holding C-spine, we are going to log roll this patient and check the back of him. We're going to feel down the entirety of the spine to make sure there are no contusions or fractures or any kind of compressions occurring, that his spine is stable, and then we're going to check for decap-BTLS on the back as well to make sure there's no exit wounds or entry wounds, or he's not pooling blood on the back that we haven't taken notice of yet. We're also going to check for like a quick rectal examination, just visually, to make sure there's no signs of bleeding occurring down there. He is fine. As I said before, he does have a little bit of abrasion on his hands, although that is a minor issue. He has very clear signs of shock, so I'm going to load him onto a stretcher, wrap him in blankets to keep him warm, keep him in a supine position, and load him up into the ambulance and drive him to the hospital as quickly as possible. We're not going to be taking care of the femoral injury right now, just because it is will take up too much time on scene, and he is definitely having a threat to his potential life. So we want to get him to the ER, into the hospital as quickly as possible, so they will take care of that when he gets there. Other than that, like I said, I am checking his vitals every 5 minutes to make sure he is not having any signs of degradation and his shock is not setting even more. And once we get to the hospital, I'm going to fill in the nurse or whoever is attending of the situation. Motorcycle accident, unconscious patient with a femur fracture and abrasions on his hands from the accident itself. We're going to fill her in with the vital signs, so she knows what's going on with that, and then we're going to have ample transition of the patient to the ER, and that would be the scene. Did I hit everything on here? Yes.